I really wanted to become a family practice physician. I grew up in my grandfather's home. My grandfather was a general practitioner. He'd usually get up at 5 or 6 in the morning, doff his black hat, take his black bag, and off to work he would go. He'd usually come home in the evening, 7 or 8 o'clock, and would be sitting at the dinner table late, and he would get a phone call, and he would kind of nod his head, put on his cap, grab his black bag, and out he would go. And it always seemed to me the great way to have a practice. He had people knock on his door. I can remember any number of times where he was sewing up people or talking to people in the home, and it just seemed a very friendly and a compassionate way to care for a group of people, and people loved him and he loved them, and hopefully I'll be the same way. I came to this healthcare system because I wanted to be able to care for a large group of people, both young and old, and this sort of practice lends to that. If you come into my office, I think you'll find I'll greet you with a smile, I'll greet you with a firm handshake, I'll ask you a little bit about your day, and of course at some point I'll ask you while you're there, hopefully not just to say hi to me, but because you have a problem, and I'll do my best to try to get you through it and get you better, and I try to put my whole heart and soul into it. When I'm not in the office, frequently I'll be reading a good book. I like science fiction, I like historical fantasy, I like historical. I'll be jogging, or I'll be reading comic books. I'm a comic book collector, and collect those and read those and enjoy those.